Good morning and good afternoon. Welcome to the Weekend Wellness Hours show. Today we have a returning guest, Dr. Tatiana Thom, who I'm very excited to have back. She did a great interview with me. We had a great conversation before on kidney health and what are some steps that you can do to change your lifestyle to improve your kidneys. And she gave us some amazing steps. So I wanted to have her back so that way we could talk about what happens if you have some kidney conditions. What can you do about them? And just learn a little bit more about our kidneys, why we want to minimize some of the conditions that often show up. So thank you so much, Dr. Tatiana. Thanks for coming on today.
It's my pleasure. Thank you for inviting me. I'm very enthusiastic talking about the kidneys, especially because I'm a nephrologist, of course, but I'm very enthusiastic about talking about what we can do beside, taking medications and just kind of wait for things to get worse, what we can do to, prevent decline of kidney function or declining health.
Yeah.
Because, more and more evidence is showing that you are not just supposed to get high blood pressure or kidney problems with aging. We have enough reserve in our body to last, for around 130, maybe 150 years.
Really? That's fascinating because we always kind of think when you're little, you hear people say, oh, when you get old, things just start to decline. That's normal part of aging. So now the research is coming out and showing that kidneys can really be healthy. Wow, that's great to hear.
What happens with aging is that, there is a wear and tear of aging. Mm-hmm. But this was all planned out by the creator that we have enough reserve so we can still age with health. Mm-hmm. But what happens is that majority of us is aging really badly, and the kidneys are aging quicker and quicker, and we are losing the reserve so much that, more and more people on their 40s and 50s, we start seeing an enormous amount of kidney disease. Used to be like 3% of the population. Nowadays, we are almost going up to 10. And there are some statistics, that believe that, by 2050, we're going to have 30% of the population above 50 years old with kidney disease.
Wow.
It is shocking. And the reason for that is really bad upkeep of our health, mm-hmm. which means that people by the age of 40 or 50, their lifestyle was so bad, so detrimental, so injuring to the body that by 40, 50, you already consumed all the reserve that was planned out to last for 150 years, 130 years. But we burned it out, and then we start seeing disease.
Wow. So, and a lot of this is lifestyle, kind of some of the things we talked about last time. Is some of it related to the chemicals in our food and water and air? Do we know?
Absolutely. There is research that shows that, many diseases are much more prevalent on highly polluted places, like cities like, Sao Paulo in Brazil, Ciudad de Mexico, mm-hmm. Mexico City, mm-hmm. in Mexico, mm-hmm. and some cities in China where it's very polluted. So the more pollution, you definitely see more disease. But it's not just that. Of course, it is chemicals in our foods. There are many like emulsifiers on preserved foods. There are many preserving chemicals from like lunch meat and deli meat that are known to cause colon cancer, for instance, and kidney problems for like 30, 40 years now. Since I'm a little kid, I hear my mother saying, no, we don't eat bologna. We don't eat deli meat that causes cancer. That is very well known, but somehow those chemicals were still going on. In some countries, some of those chemicals, were recognized and, of course, prescribed, meaning they cannot use anymore. Like in Canada, several countries of Europe, they have ban several things, but in the United States, not almost anything is banned. Nothing is banned. There is some warnings here and there, especially in the state of California. They do give warnings on different plastics, on different materials that are associated with, like, fetus malformation for, pregnant women, or just with cancer. But they were not banned yet, and we are exposed to a growing amount of processed food with substances and plastics, like, as the wrapping, that have been associated, like, for instance, BPA and phthalates are very associated with endocrine disruption, like more thyroid problems, more diabetes, and more high blood pressure, and also testicular cancer, leukemia, lymphoma, like, blood cancers. And of course, the more exposure you have, the more amount of processed food you eat, the more plastics you use, of course. And then you add some other risk factors, right? Smoking, pollution, air pollution, but especially smoking is one of the biggest risk factors for any kind of shenanigans, health shenanigans you can get into it. More than health shenanigans too, but smoking is a huge one that will destroy your kidneys to the ground, not just your lungs. It's not the only risk factor, but it's a major one. So if you want your kidneys to last longer, for instance, if you want a longer health, smoking is a go there. Then alcohol is another one that has many risk factors for many things, but increasing blood pressure is one of it. And heart failure is another one for alcohol, heart arrhythmias, and of course, all kinds of cancer and liver disease. So there are many things in our environment that we keep, like, eating up our reserve, like increasing tremendously the amount of wear and tear, and you just age badly. And then, of course, people like, with age, people get high blood pressure and this and that. And they even used to teach that people get declining kidney function from aging, the numbers go down. No, that's not true. It's been shown for over 10 years, 15 years now, that it's not true. There is a normal wear and tear, but most people are like blowing this, like really burning out much sooner than expected. And it's lifestyle for sure. Lack of exercise is another thing. So if you have kidney disease, there is studies that show that people with the same amount of risk factors and the same function of kidney, so kidney disease, let's say stage 4, which is like, a declining kidney function of about 70 to 80%. And then those two people with the same kidney dysfunction from the same reasons even, and if nothing catastrophic happen with them, if the group that exercise for about 30 minutes 3 times a week, their kidney function was stable for much longer than the people that didn't exercise. So the curve for the people that didn't exercise was a very progressive decline. And just isolating this risk factor, there are many more things you can do to preserve your kidney function, even if you already have kidney disease. And of course, doing those things will prevent as well. Most of them, which is about 90% of the causes, are preventable. But the people that exercise, they're stable for much, much, much longer. They don't have that curve of decline. So exercise is another one.
Wow. So let's talk a little bit about high blood pressure, hypertension. So do you see that happening in younger and younger ages nowadays, or is that still considered more of like older? So it is younger.
We're seeing younger and younger people, even people in their 20s. There are many risk factors for that. One of them is, of course, obesity. The bigger you are, the more likely you are to have high blood pressure. And of course, the more processed food you eat, the more salt you are getting, the more other chemicals you're getting and are contributing to increase your blood pressure. Alcohol as well, another one. We are seeing hypertension a lot in people in their 40s, which before this was not that common. But why? Because people are losing their kidney function. The kidneys are the main controller of your blood pressure, and people start retaining salt, retaining water, and blood pressure start going up. And of course, that has to do with stress. Lack of exercise is huge. So sedentarism, is a huge contributor for high blood pressure, and of course all kinds of heart problems. And that's another one. I believe that, people are getting more obese, more sedentary. Everything is done by the car. People don't walk anywhere, especially if you're not in the inner city, of course. And of course, all this amount of processed food and sitting, is a new smoking.
Yes.
We're seeing, and I'm sure you can talk about this like for 3 days in a row, right? How the sitting is a terrible thing for you. But on the medical side, we know that being sedentary, which means less than 4,000 steps per day, increases your chances of hypertension, cardiovascular disease, heart failure, stroke, erectile dysfunction, all kinds of cardiovascular problems, and increase your mortality. Basically, you die younger.
Gosh. And how much does stress play a role in hypertension as well? Have you looked at those effects? Because we know stress is kind of high right now with a lot of people.
It's huge. We see that a lot of people come to the office and their blood pressure is high. And they're like, oh, no, I always get nervous when I am at the doctor. That's why my blood pressure is high. But actually, there are many studies, like as early as like 50 years ago, 60 years ago, that shows that even if your blood pressure is just high at the doctor's office, but when you measure at home, your blood pressure is normal. When we look at in two different ways, it was looked. First, when they did a 24-hour blood pressure monitoring, meaning, there are some monitors that they have a cuff that goes in your arm, and it's connected to a little pager that will be, recording and transmitting that information. And the test is done in a way that every half an hour, the monitor goes off and checks your blood pressure. And at that time, preferably, you want to just, stop talking and walking, but you don't have to do anything special, right? But you are supposed to do that in a normal day. And when they look at those studies with thousands and thousands of people, they saw that the same blood pressure that we saw in the office happened several times throughout the day. And that's when you're stressed. And several people were able to, log and they're supposed actually to log throughout the day what they were doing when that monitor went off. And some people, of course, they don't even feel it anymore because it will go off 50 times. And then you're supposed to give us a ballpark of what you're doing. And then we saw that several people were like, oh, I was driving and I was hitting traffic, or I got some crazy driver. So the same stress that you get of frustration of, the traffic will be the same amount of stress that is causing you to be at the doctor. So they saw that people that have that high blood pressure at the doctor also had high blood pressure about 30 to 40 times or 40% of your day. And the other research shows that if you have high blood pressure in the doctor's office, even though you had normal blood pressure at home, you are at increased risk of cardiovascular disease. So we know that you have enough high blood pressures throughout the day. When you receive an unpleasant phone call, when you watch the news, when you have some other little frustrations in your day, your blood pressure is high at those times too, if you have high blood pressure at the doctor. And the research independently show that your outcomes are worse. You were going to end up having more heart attacks, more stroke, more, vascular disease from having just that high blood pressure at the doctor. And we see that in people nowadays, even on their 20s, on their 30s, people that are obese, people that are not obese, people with no other type of diagnosis, and, some serious food for thought there.
Yeah, because if you're having hypertension, I can imagine it's a sign that your kidneys aren't functioning well. And so that can lead to other, conditions with your kidneys in the future. So obviously you hear about a lot of blood pressure medications out there. What are some other really actionable steps people can take to start looking at, okay, if I don't want to do medication, what can I really do and implement that will help me lower my blood pressure on a daily basis?
All right. So that's a great question. I love talking about that. I always spend some time with my patients talking about it. And it's around 5 things that you can do. And of course, the better you implement them, right? The more consistent you are with multiple of them, the better you be. And they will actually help your blood pressure. But what helps blood pressure helps cardiovascular, helps your brain health, helps your heart health, your vessels health, helps everywhere, right?
Yeah.
And actually your mind too. So let's go to that. The first thing I would say, if you already have high blood pressure, if you want to prevent your declining blood pressure and declining kidney disease, one of the things is that cut down the amount of processed food. And we have a specific amount of sodium, potassium, and magnesium that we recommend. There is a study that showed that a diet and it's called DASH diet, which is an acronym for Diet Approach to Stop Hypertension, which is a diet that limits your sodium intake to 2,000 milligrams a day. And which not that little if you eat more on the produce side, more produce and less processed. It's not that little amount. So limiting your sodium intake to 2,000 milligrams a day, increasing your potassium intake to 4,500 milligrams a day, which actually is very hard with the lifestyle that most people have. That usually entails eating 6 to 8 servings of potassium-rich vegetables and about 2,000 milligrams of magnesium per day, which entails you eating, a good 6 servings of magnesium-rich fruits and vegetables per day, which actually is not that hard. What I recommend to my patients is make sure your breakfast start with fruit, and especially the fruits rich in magnesium. So I recommend the healthy way is never cereal. Cereal, there is no healthy because it's processed sugar. Even the ones that are not sugary, cereal is a simple carbohydrate, and the way that it's processed becomes pretty much sugar. Even the ones that are cream of wheat and all those things that people believe it's healthy, like Cheerios and everything. They're worse, but they're not great. So I always recommend like a real oatmeal with fruit. I have to say, my culture background, oatmeal is not a thing. And when I started coming here, and I've seen people eating oatmeal, and of course the healthcare promoting that, I tried. I was like, ooh, this is gross. I cannot do that. This is mushy and tastes like nothing. But you know what? With time, I actually learned how to do oatmeal. And the way to do it is with fruit. So if you slice some bananas there, if you put cinnamon, nutmeg, there are some spices that comes already mixture, like, apple pie spice or pumpkin spice. That comes already that mixture that we put on pie. You put it a good amount there, and you put it with fruit like apples or bananas. I swear to God, that tastes like a pie. You are like having dessert for breakfast. Hello, a healthy one, right?
Exactly.
And or you can do like a fruit salad, or eat a fruit, or for instance, my husband got into the habit, and it's so funny because my kids do what my husband does because he's the one that prepares breakfast, and he eats oh my goodness, my mind blanked now. The name of that fruit is that big orange that looks like red inside.
Mango? Not a mango.
No,
a cantaloupe.
It looks like an orange.
It looks like an orange.
No, it is like an orange, but it's red inside. It's oh my goodness.
Well, there's different types of oranges out there.
Grapefruit.
Oh, grapefruit. Okay.
So he eats a grapefruit. And I don't know, that doesn't taste too good for me, but my little kids, they eat a grapefruit and they drink tea because that's what my husband does. So, my point is you can incorporate this, and this is a learned palate, a learned taste, right? The same way people somehow love beer, but beer actually tastes horrible. And same thing with wine, and it's acquired taste. And I grew up eating vegetables and fruit, and for me, they taste great. Some people didn't. They grew up with a horrible tasting cereal and a bunch of other horrible tasting processed food that for me tastes gross, like absolutely artificial, but some people like it because they grew up with that. So it's what we call comfort food, right? That is associated with comfort. It's an acquired taste because it goes way beyond the palate, right? The taste buds.
Yeah.
But anyway, I diverge here a little bit. But, I wanted this to be functional and people just not dismiss it because like, oh my God, I'm not going to eat a grapefruit in the morning. But I'm just giving an example that, little kids even do it when you think they just eat sugar because, again, they grew up with their father eating that for breakfast. Well, that's breakfast for them. And another option besides eating fruit and a fruit, a fruit cup or, a fruit salad, which I think is the most delicious thing ever. You can do a fruit smoothie. That's actually most days is my breakfast. I do like a vegan protein, which is usually based on peas, like split peas. Of course, it doesn't taste like peas. Or you can do whey protein if you want. We don't recommend because there are many, many studies showing that whey protein, which is a cow's milk protein, is highly inflammatory, causes more cardiovascular disease, causes very associated with cancer. So I recommend a vegan protein. It comes with a powder, right? You just put it in there. Some comes flavored like vanilla or chocolate or, a lot of them come already with other different fruits. So it has a fruit taste. And then I actually put berries in it because berries are so rich, right? They are so rich in vitamins, minerals, antioxidants. You know what? They have very little calories.
Yes.
Very low insulin index, glycemic index. So it's not going to shoot up your sugar because, of course, we hear about no juice. Juice is very sugary, has too much sugar. But berries have very little. So I of course I add with the protein and some fiber in it. So it becomes a more wholesome breakfast that doesn't spike your insulin, doesn't make you crave for food right away. So that's most of the days of my breakfast. And it's so quick, right? I just like powder. Most of the year I do frozen berries. They even sell the mixed berries. So why I'm talking about this? Because I want you to get more potassium, more magnesium, less sodium, and more fruit. Because again, that has shown, research is not what I think, that will improve your blood pressure because you're getting more of those minerals and antioxidants and will relax your vessels.
Yeah, you're getting more live foods instead of dead ones, dead processed things.
Absolutely. So that's an idea. I'm here, of course, giving examples to make it more palpable, more useful of how to incorporate this DASH diet, right? Low in sodium, high in potassium, high in magnesium. Another one that some people cannot, detach themselves of their toasts. So instead of putting butter in toast, of course, I don't recommend toast because bread is it's very sugary, right? Even though it's not sweet, it has very simple carbohydrates. And what I recommend, if you cannot get rid of your toast, instead of just doing butter, you put avocado slices on top of it. And avocado is very rich in potassium, magnesium, and healthy oils. And again, has so many antioxidants, vitamin E, and it goes on. It's so healthy and rich. You don't have to do that every day. Actually, I do recommend a variety. But those are ways you can get a fruit in. And for some people that may look confused, avocado is a fruit. It has a seed. And then another thing is incorporating your lunch and dinner, always having a side salad at least, or a big salad, and of course with a variety of things, and 2 servings of vegetables. Like for instance, a little bit of broccoli with olive oil and garlic. You can use garlic powder even, or a little cauliflower, zucchini, green beans, whatever you like, Brussels sprouts, asparagus, whatever. And there you go. If you incorporate 3 servings of veggies at lunch and 3 at dinner, there you go. You did 6. And then if you do 2 or 3 in the breakfast, there you go. If you do that consistently, trust me, your energy will change, your health will change. You'll be preventing all kinds of declining health and disease and symptoms. And you know what? It's tasty. With time, you see that, you're eating much better, much healthier. And again, I know that, fresh produce is expensive, especially we that live here in the North Pole. I live in Boston. And then, and in many places, of course, it's very expensive. But frozen vegetables and frozen fruit tends to be much cheaper. And you can do that. And again, you can buy a bag of frozen vegetables or fruit for like $2.50, $3 in Walmart or even Target or even
yeah.
other grocery stores. So it is doable. We just want to plan ahead and try it. Just try it and see what happens.
Absolutely. So that was excellent for explaining like some options to get away from processed foods. And so you mentioned that as one of the ways to decrease high blood pressure. What were some of the other ways as well?
So another thing is cut down the alcohol.
Okay.
I know that a lot of people use alcohol as their kind of stress reliever or social interaction kind of thing. And well, that's not only a lot of calories, a lot of sugar will drain your energy, but also the alcohol increases your blood pressure. So limiting the amount of alcohol is huge for your blood pressure. And of course, for so many other things, but we do recommend never having more than 2 drinks at a time. And actually overall for a woman, I would say 2 drinks per week, you are decreasing a lot of health problems, including cancer, breast cancer especially. And for men, max of 4 drinks per week.
Okay. So
another thing is exercise, right? We talked a lot about, do you want to go back and talk more about alcohol?
No, that's good. That's perfect.
Oh, I just want to remind that a drink is not a glass, right? A drink depends on the drink, like a hard liquor is 1.5 ounces. If it's wine, it's 3 ounces. So just be mindful that a lot of people, what they call a drink, it's more like 3. Because of the size and the concentration of alcohol, of course, the percentage. And then exercise. Exercise is huge to prevent high blood pressure and to treat your high blood pressure. During exercise, a lot of people will have a reaction of increasing right there. So much that, when we do a stress test, we see a lot of people, they get high blood pressure. But the best effect is right after the exercise, your vessels relax. And that has an effect that is really long-term throughout the day and throughout your life. So if you want to decrease blood pressure, you definitely want to pick up a habit. And we do recommend about 30 minutes, 5 times a week. And that has I could talk the whole day about the benefits of that little bit. And just to put in perspective, we are like, oh my God, 30 minutes, I don't have 30 minutes. Well, we have 1,440 minutes per day. Everybody, right? God gave us 24 hours a day, 60 minutes per hour. And that math comes out to 1,440 minutes per day. We do not spend more than 440 minutes with our basic living things like sleeping, eating, taking a shower, just the basics, right? Survival. And then we have 1,000 minutes to, allocate wisely where we want. Yes, a lot of people do work a lot and they will work 600 of those 1,000 minutes maybe. But it's still, let's say there are 400 minutes. So you're telling me that in all those minutes, you cannot take half an hour or even 15 minutes. That will benefit you for sure. To exercise. And exercise can be anything. Dancing is one of the best exercises. There's lots of research nowadays showing that dance is the best exercise. It can be yoga, Pilates, walking. Walking is fantastic. It doesn't have to be like, something specific at the gym.
Yeah. Oh, that's wonderful. So, okay. So we have cut down processed foods, alcohol, and then exercise. And then are there 2 more?
Yes. So a few more things. Sleeping, the quality of sleep interferes with your blood pressure, especially if you suspect you have obstructive sleep apnea. And if you live with someone, that someone may say you snore, and sometimes you're snoring and it seems there is a pause. That pause in the snoring is your brain trying to wake you up and say like, oh, I'm not getting oxygen here. And that low oxygen that happens when, in the between the snoring, that you're not being able to, breathe, getting oxygen causes high blood pressure, causes heart failure, causes early dementia and arrhythmias in your heart. So screening for sleep apnea if you snore if nobody tells you that you snore, don't have anybody there to tell you or to poke you or turn, your symptoms could be that you wake up feeling like you're tired, or any little bit of a time that things are very calm, like you start watching TV, or right after lunch, you start feeling so sleepy, or even like you start taking cat naps, right? And that's a symptom of sleep apnea.
Okay.
In car accidents, very often are due to sleep apnea. So if you had a few car accidents, that you want to check for all that, and that's a cause of high blood pressure as well, among other things like we talked. And you definitely want to screen for that, especially if you have a big belly and you're not a little tired, taking cat naps when you shouldn't. So treating sleep apnea is a huge one. And of course, excessive weight, right? So losing weight is huge for high blood pressure, and it's very important to take all these measures, and everything I said that will prevent high blood pressure will also help you lose weight. So losing weight is huge. Even a loss of like 5% of your weight will impact your blood pressure. May not just make you, cut down from like 2 medications to 1, but I had many patients that losing weight and exercise and eating healthy were able to get rid of medication, even 2 medications. That's not super common because, again, you have to be consistent with all of that. But with consistency, I had patients, cut down amount of medication, or they had a high blood pressure and the high blood pressure disappeared. Like I see that very, very often in the office. But of course, got to do it and be consistent. And I would say another thing, people with diabetes tend to end up developing high blood pressure as well. And controlling your diabetes, controlling your stress and your hormones will improve your blood pressure, because high insulin, which diabetics have, makes you retain more sodium, makes you retain more fat, makes you retain more water, and that will increase your blood pressure as well. And that's the mechanism. Stress increases your blood pressure because stress creates high cortisol, high noradrenaline, higher adrenaline, and increases resistance to insulin. So you secrete more insulin and retain more sodium. And of course, with those high cortisol, you increase several other hormones that retain salt and water and increase your blood pressure. So, dealing with the stress, and of course, those things are dealt with breathing, right? The master, Amy here is the master of that. You deal with stress with breathing, with exercise, with connection with people, and there are so many ways, right? Therapy and eating healthy is part of it for sure. So we talked. I kind of rushed through this end here of how to deal with blood pressure, but we covered a lot of ground here, a lot of changes that, again, will not only improve your blood pressure, but will improve your health altogether, and your mental health, right? Your emotions, your psyche.
Yeah, absolutely. And I mean, so many people, they can just pick a couple things and start implementing and make the changes. Now I'm going to, and I want to see, so with kidney disease, are a lot of these recommendations would also help with someone who was diagnosed with kidney disease?
Absolutely. So the main things a person with kidney disease need to do to, at least stabilize their kidney functions, instead of, progression, decline, burnout. What we want to do, there are several things. One of them, the most important one, most people that have chronic kidney disease, they also have high blood pressure. So one of the most important things not to burn out your kidney is control your blood pressure. So the goal of blood pressure control, 80% of the time for a person with kidney disease, is a blood pressure that is less than 120 on the top number and less than 80 on the lower number. So you need to monitor more often than just go to the doctor every 3 or 6 months or 1 year and see if it's okay. We have the blood pressure is like, an internal thing that is 24/7, right?
Yeah.
And you do want to monitor a few times a week, or if it's uncontrolled, even every day, and make a log and, call your doctor, go to your doctor more often so we can get at that goal, and that your blood pressure is 80% under that goal, under 120/80. And how we reach that? Well, we just talked about a lot of things that can help you do it, right? Lose weight, exercise, cut down alcohol, screen for sleep apnea. We talk about a bunch of things, right? Yeah. And then, of course, you want to do those things and monitor, see if that go. And if it's not, go to your doctor, change medication, increase medication, ask for, help. But of course, it's the person that has to be invested on it, right? Because again, if you don't care about your health, my friend, it will just not fall from the sky, right? You do have to be your advocate. You have to take responsibility and do the things. And again, if things you're not being able to do it on yourself, set an appointment, go to your doctor, and monitor blood pressure every day, or at least a few times a week. It takes 1 minute, and a blood pressure monitor is something you can buy for $25, $30. And it's so simple. It takes less than a minute. You just put the cuff on, sit down on the table, relax your shoulder, relax your arms, both feet on the floor, uncrossed, and you press a button. In 30 seconds, you have a number. Write down and make a little log on any kind of scrap paper, book, whatever, notebook, whatever. Or leave it there in the machine and bring the machine to your doctor, even better. And then we'll figure it out. You're not a goal. Let's do the changes. And, until you're able to implement the changes, sometimes we need adjustment in medication, and that's okay. Even if your blood pressure is not solved by a lifestyle change, if it's well controlled because of medication, doesn't matter if it's 1, 2, 3, 4. There are many people on 4 medications. Of course, if you're on 4 medications, that is definitely a red flag, meaning maybe there are some bigger hormonal problems, or even genetic modification. There's something going on that we need to investigate, and that you see a nephrologist for. We'll take care of that, or endocrinologist in some cases. But if you need 4 medications to control your blood pressure, as long as it's controlled, you have a benefit. But it's an alarm sign. If you're really needing 4 medications, there is several wrong things going on, and it's not just going to affect your kidney and your blood pressure. Your cardiovascular disease, your heart, your brain, your whole entire body and health is in bad shape if you're needing that much.
Yeah, absolutely. So this is good information. So basically everything that we work towards to decrease our blood pressure will help us with kidney disease. And with kidney disease, there's several different stages of it. So it's not like you have it or you don't. There's different levels as your kidneys function is declining. And we also know that you can increase your kidney function to kind of move a little bit higher on those stages as well, correct?
Yeah, that is a complex subject, and it has something to do with how we measure kidney function, which is not ideal. And unfortunately, we still don't have. There are studies and, of course, proposals of all kinds of things, but we still don't have what we consider ideal, a good way to measure kidney function. But we have something, right? We call creatinine. We measure in your blood. And it's a toxin that we want to see cleared off, right? We want to see a low number in your blood, meaning you're filtering it out, you are excreting it, you're getting rid of it. So the number in your blood is low, which is good, meaning you pee it out. But the higher it is, the worse is your kidney. You're not being able to clear that off. You're not being able to dump it out. And that's how we measure, through that creatinine. And of course, depending on, and with that number of creatinine, which depends on muscle mass, health of your liver as well, how much protein you eat, how much muscle mass you have. So it depends on so many things. You need a very educated eye, a nephrologist, to be able to interpret that number. It's not just a hard number like that. It depends on so many things. But we use that creatinine number in a formula to calculate what we call a GFR, glomerular filtration rate. The glomerular is the name of this structure in the kidney, which is the filtration unit. And we have millions of them on each kidney. And then what happened is that if your GFR is declining, meaning your filtration rate is going down, meaning you're not being able to filtrate your blood and dump the toxins very well. And depending on the percentage of that, you are in CKD stage 2, 3, 4, or 5. And 5 is the worst, of course. When you're 5, you're pretty much close to not filtering, not even like 10% of your blood. And that's too much toxin pile up. Probably don't feel good. You feel fatigued. You feel foggy. You don't sleep well. Your appetite is bad. Some people get itchy. And then it's time for dialysis or a transplant. Otherwise, you're not going to last much longer than 6 months and not a very great quality of life. But in order to prevent getting there, first, we need to get that blood pressure well controlled. The second thing is diabetes, because most people end up with kidney failure because of diabetes uncontrolled. So you want your diabetes super well controlled. You want that blood sugar super well controlled. What that means a fasting blood sugar less than 120 and a hemoglobin A1C. So that name, hemoglobin A1C, is a marker that we do that is the average of 3 months of your blood sugar. So it doesn't matter if it's fasting or not. It will tell us the average of the last 3 months, and you want that number below 7, which is not even normal. Normal is below 5.5. A normal person with no diabetes is less than 5.4, actually. But for a diabetic, a number below 7, we know that will decrease your kidney decline. A number above 7, anything above that, and of course, the higher it is above that, you're burning out kidney like crazy. You're burning out your vessels, your nerves. You are more close to have all kinds of complications of diabetes, which is blindness, losing a limb because of infections and ulcers, heart failure, heart attacks, stroke, all kinds of vascular disease, like peripheral vascular disease, clogging up of our arteries. You can have that in your gut even. And people have problems when they eat, diarrhea, pain, and erectile dysfunction, right? And all kinds of vessel problems, basically. So you do want to control your diabetes so your kidneys can stabilize and you stop burning out kidneys. And then, of course, you want to drink enough water. If you don't drink enough water, the blood flow to the kidneys go down. The kidneys cannot even dump out the toxins, right? How the kidneys dump toxins out of your body? Through the pee, the urine, right? So you need enough water so you can do your proper bodily functions and you can pee the toxins out. And you need an amount, a minimal amount. And if you're very active, if you're an active person, you want to hit those 64 ounces. If you exercise, you probably want to hit those 75, even 90 ounces. If you have kidney stones, you definitely want 90 ounces. If you are like an older person, sedentary, not very active, most people 45 ounces will do.
Okay. Wow, this is amazing. So much good information all about helping people. I really appreciate it. Is there anything else that we didn't cover regarding the kidney disease and helping kind of boost your kidneys back up?
So one huge important thing, both for high blood pressure and especially for kidneys, is staying away from the anti-inflammatories. That ibuprofen, naproxen, Aleve, Motrin, Advil, those anti-inflammatories. I'm talking about those over the counter. Of course, there are many more, like, meloxicam, Celebrex, all of those that are usually prescribed by doctors. Diclofenac, there are so many. I could spend like an hour just talking about different names, but basically people over the counter love to pick up a little ibuprofen, naproxen, Aleve, Advil, Motrin. Those for increase your blood pressure, and especially they can burn down your kidneys through the ground. In different mechanisms, actually, they have 3 different mechanisms that can harm your kidneys. So if you have chronic kidney disease and high blood pressure, those are not for you. If you have a little pain here and there, you can do Tylenol. But if your pain persists to the point that you're taking that very often, you need to go to your doctor. You need to come up with why you are having that pain and how we're going to solve this. So you stop having pain and you don't need pain meds, right? Chronic pain is not normal. It's common, but that's not normal. There's a problem. It's an alarm. Your body's saying something is wrong. You're harming me. Let's stop this injury now. And you have to go to your doctor, and maybe you have to see a specialist. and you need some treatment, and you need physical therapy, you need to exercise, you need to lose weight, you need to drink more water. That will solve a lot of chronic pain. You need, again, to start losing weight and exercising. Maybe you need physical therapy for a while. You need acupuncture, going to the chiropractor. You need something, right? You need to go places to fix the pain, because having pain is not a lack of pain medication. Having pain is a big problem that needs to be identified and treated, right? So you don't need pain meds. So basically, don't stay at home popping ibuprofen or Tylenol. Meanwhile, you are damaging your liver and your kidneys and increasing your blood pressure and later collecting the consequences of it. Please stand up, go to the doctor and try to make a plan. Don't ask for a pain pill. We don't want you to be in pain, but the solution for the pain is not a Band-Aid or a pain pill. It's something else, right? Learning why you're having pain. And that's a big deal. A lot of people lose their kidney functions just from chronic ibuprofen due to knee pain, headaches, tooth pain, menstrual cramps. A lot of women tend to do heavily for like a week of a month, every month, and then a little bit more for headaches. And all of a sudden, you have kidney failure.
Yeah, not good. Not good at
Not
all.
good.
Wow. Thanks for bringing that last topic up, because I know that will waken some people up. They'll open their eyes, because it's not often talked about. So really appreciate you coming on again today and sharing valuable information. How can people reach out to you? What's the best way?
Well, it's my pleasure being here. I'm very passionate about, preventing problems and, bringing health to people, right? We want people to be healthier, have more energy, be more joyful, and, be free, not be grounded. Grounded in a way of having their body drag them down. It's a horrible thing to be sick, and it's much easier to prevent, even though it requires, of course, discipline and consistency. But I have a channel in Instagram where I talk a lot about health, and especially the mind, the psych aspects of it, the emotional aspects of it. But it's a channel that for now is just in Portuguese, since I'm Brazilian, and I vow to serve the Brazilian community, the Portuguese speaking community first. So my channel there is at Doctor, in abbreviation, DRA, the A, because in Brazilian, in Portuguese we have that inflection of feminine. So like Doctor, DRA, Tatiana, Tatiana, and my last name Thom, Thom. So you can find me there. And also, I work at a private practice in Lowell, Massachusetts, which is the northeast of Massachusetts. And it's called Mill City Medical. So, if you live around, you can set an appointment, and I'll be happy to see you guys there.
Wonderful. Well, really appreciate it. Thank you so much for your time. It was such an honor. Okay. Thank you all for joining us today. Have a great rest of your weekend, and we will see you again next week. Bye now.